Welcome to This Explainer, where we demystify chest anatomy. Seriously, have you ever stopped to wonder what exactly is happening beneath your skin when you take a really deep breath? Well, today we're breaking down the thoracic wall muscles, and we're keeping it completely beginner-friendly. Let's dive right in and decode the incredible engineering of your chest.
So, you know your pecs, right? We see those all the time. But what muscles are actually hiding between your ribs to physically power your breathing? Today, we're going on a spatial and functional journey, starting from the outside and working our way in. We'll start with the superficial armor of your chest, and then dive deep, layer by fascinating layer, into the hidden breathing engine tucked inside your ribcage.
Section 1. Superficial anterior chest muscles.
Our first stop is that superficial armor I mentioned, the pectoralis major. It's a remarkably thick, paired, fan-shaped muscle that spans right across the front of the thorax, stretching from your shoulder all the way to your sternum. And it's actually made up of three distinct parts. You've got the clavicular part up near the collarbone, the sternocostal part right in the middle, and the abdominal part down at the bottom. Clinically speaking, this is the main muscle you're working, and yes, sometimes straining when you're doing push-ups.
Functionally, this muscle acts as a massive lever for your arm. It's responsible for adducting, which basically means bringing your arm in toward your body, and internally rotating the upper arm. Just think about the motion of giving someone a giant bear hug. That is your pectoralis major hard at work. And depending on which specific part is firing, it also helps to either flex or extend the arm.
Now, here's where it gets really interesting. If we virtually peel back that thick pectoralis major, we reveal a much smaller muscle hiding directly underneath it. That's the pectoralis minor. This little guy attaches to ribs 3, 4, and 5 and anchors them straight to your scapula or shoulder blade. Its main job? To draw the scapula down and forward, essentially locking and stabilizing it perfectly against the thoracic wall.
Let's stick with that structural support for a second. Tucked perfectly underneath the collarbone is the subclavius. It's a short, triangular muscle that originates on your very first rib and inserts right into the clavicle. Sure, it might be tiny, but its function is absolutely essential. It anchors and depresses the clavicle, which keeps your shoulder joint nice and stable whenever you're lifting or pulling heavy things.
Section 2. Lateral and posterior muscles.
If you feel the space right between your pecs and your latissimus dorsi on your back, you'll find the fan-shaped serratus anterior. It beautifully wraps around the lateral wall of the thorax. It actually gets its name because its edges look serrated, kind of like the jagged blade of a saw. In the clinical world, this is often called the boxer's muscle because it's the main driver pulling the shoulder blade forward when you throw a punch.
It's beautifully organized, too. Instead of getting bogged down in all the tiny details, just notice how its superior, middle, and inferior parts cleanly segment across the different ribs. They wrap right around to attach to the inner border of the scapula. This wide, segmented attachment is what allows it to so efficiently move and gracefully suspend the scapula against the ribcage.
Shifting to the back now, we find the levator's castorum. These are deep back muscles stretching from the transverse processes of your thoracic vertebrae down to the ribs. Now, this part is often misunderstood. While their name implies that they elevate the ribs, and okay, they do gently assist in breathing in, their more practical, everyday function is actually helping to rotate the thoracic spine. They form the absolute deepest layer of your back muscles.
Section 3. The 3 intercostal layers. All right, let's dive into your true breathing engine. You see, the space between your ribs isn't empty at all. It's meticulously layered. In every single intercostal space, you have an external, an internal, and an innermost intercostal muscle. Working together, these 3 layers form a dynamic, highly flexible wall that seals up the chest cavity while still allowing it to dramatically expand and contract.
The crucial thing to understand here is how these layers actually work in opposition to each other. This functional contrast is vital for breathing. The superficial external layer works to pull your ribs up and out during forced inspiration. Think about taking a massive gulp of air right before jumping into a pool. Conversely, the internal layer right beneath it pulls those same ribs down and in during forced expiration, like when you're blowing out a really stubborn birthday candle.
If you look closely, you can see the external intercostals passing obliquely downwards and forwards, running from the rib above to the rib below. A really great beginner trick to remember this is the hands in pockets analogy. The muscle fibers run in the exact same direction your fingers point when you slide your hands into the front pockets of your jacket. Pretty cool, right?
Immediately beneath those, we have the internal intercostals, and they run in the exact opposite oblique direction. They extend from the angles of the ribs in the back all the way to the sternum in the front. And because they form an X shape with the external layer right above them, they create this incredibly strong, cross-hatched structural web. That's what stops the tissue from bulging in or out when the pressure inside your lungs changes.
Then we hit the deepest layer, the innermost intercostals, and these are just fascinating. They run in the exact same direction as the internal layer, but there's a vital physiological secret hidden here. Your vital intercostal nerves, arteries, and veins pass safely through a tiny little gap perfectly sandwiched right between the internal layer and this innermost layer. It's essentially a highly protected superhighway for your blood and nerve supply, keeping them completely safe from friction as you move and breathe.
Finally, let's wrap up our spatial journey with Section 4, deep inner thoracic muscles.
Moving right to the inner surface facing your lungs, we find the subcostal muscles. Now, unlike the intercostals that just hop to the very next rib, these unique bands skip across 2 or even 3 spaces. They're mostly well-developed down in the lower thorax and act as super strong anchor points to aggressively depress the ribs. This means they heavily assist you when you really need to forcefully exhale.
And deep within the anterior wall, right behind your sternum, sits the transversus thoracis muscle. It reaches out kind of like a starburst, attaching the lower part of the sternum to the internal surface of ribs 2 through 6. When this muscle contracts, it actively pulls down on the costal cartilages, which is the flexible tissue connecting your ribs to your sternum, helping you completely and forcefully squeeze out that very last bit of air from your lungs.
So, to summarize our explainer today, just keep these 3 key takeaways in mind. First, the superficial chest muscles act primarily as protective armor and powerful levers for moving your arms. Second, those 3 intercostal layers act as your dynamic, cross-hatched, true breathing engine. And third, the deepest thoracic muscles act essentially as your biological exhaust system, jumping in to assist with forced expiration.
If this explainer helped simplify chest anatomy for you, be sure to hit that subscribe button for more simple, structured medical explanations just like this one. Remember, the more you understand your own machine, the better you can run it. So I'll leave you with this question. How often do you actively take a moment to engage that deep breathing engine and take a truly full breath? Go ahead, take one right now, and I'll see you in the next explainer.